Actually, the spine tumor is of two types. One are which primarily arise from the neural structures, which we call intradural spinal tumor. And the second type of the tumor are extradural, above the covering of outside the covering of the spinal cord, that we call extradural tumor. And the most common cause of the extradural tumor are cancers or metastasis of the spine. It can be primary, but in majority of the cases, they usually migrate from somewhere else as a primary cancer and metastasize or resides into the spine. And when it involves the spine, obviously it starts engulfing the spinal bones, which we call vertebral bodies, and start damaging them. So initially, usually patients present with a very bad and severe pain. And if we don't tackle at that level, ultimately they will completely damage the vertebral body and will change the spinal column and increase the risk of paralysis. So that's why we take the spinal cancer very, very seriously and act them as quickly as possible. So normally the ones which are inside the spinal cord are usually slow growing tumor. They primarily rise from the nervous structures. And then patients usually present with long-standing back pain and slow, weak and numbness or paralysis in the legs. So that's a slow process. So they usually come into consultation quickly and they usually sort it out that way. The spinal cancers, because there's usually primarily some other cause, and the patient mind doesn't go to that. If somebody say has a breast cancer, which is one of the most common cancer which goes into the spine. Similarly, in male, it's a prostate cancer which most commonly go into the spine. But any other cancer can go into the spine as well, like the cancer from the guts, from the liver, some from pancreas, from any other body tissue, can thyroid can metastasize into the spine. Because patients usually know that their primary was somewhere else, it's cured, it's not causing any trouble. And suddenly when they start feeling that sort of pain, they initially ignore. And same thing happens when they go to their family doctor. They think it might be just a bit of pain, which most of the time it is usually like that. But that should be taken very seriously if somebody has a previous history of spinal cancers. So when spinal cancers come to us, we take them as a first priority, our top priority, and we investigate them further by doing their scans, which includes MRI scan, CAT scan, and sometimes the radioisotope scans as well, to determine that how bad that tumor is, how much it has already caused damage to the spine, and where it is coming from, and what is the general prognosis of that tumor. Obviously, we have a multidisciplinary team here at HCA, so we immediately involve the whole team, which include the surgeons, the radiologist, oncologist, radiation oncologist, and we discuss what is the best treatment for that particular patient. So treatment is purely individualized. So then, depending upon, there are certain tumors which make the spine pretty unstable, or sometimes the spinal cord is at risk. So in those particular cases, we usually stabilize the spine before the patient have a further treatment in the form of radiation or chemotherapy. And for the pain management, obviously, we have a multidisciplinary team, which include physiotherapists, pain doctors. They are also on board. So they are actively involved in the management of the patient from day one. So when any the patient with spinal cancer usually present with out of proportion back pain initially, most of the time. And not everyone, but almost half or more than half patients usually have some previous history of cancers, which is still either active at a primary site or patient is being declared completely cured, and at a later date that tumors can start metastasizing without the patient knowledge. And the most common symptoms are very severe back pain. Then some patients, then if they ignore with time, then they start presenting with weakness or numbness in the limbs. So if the tumor is in the neck, they can present with walking difficulties, with balance issues, with losing the strength in the arms, losing dexterity in the arms. If it's in the middle spine, which we call thoracic spine and lower spine, patient can again present with the walking issues, bladder and bowel problems. These are the neurological deficit the patient usually get with the spinal cancers. And if their primary disease is active, sometimes they present with generally unexpected weight loss, recurrent infections, all those sort of things are common as well. But pain is the most predominant feature. Yeah, I think every case which comes with spinal cancer after investigation, we discuss in our multidisciplinary meeting, and we make an individualized plan. The back pain of the patient or the spine pain is due to two reasons. Either there is due to cancer growth, there is a compression on the neural structure and patient is in pain, or the second is the spine is becoming unstable. So when there's a spine is unstable, patient will be in a severe pain as well. So in the first instance, we determined the instability and then we start the treatment. If the spine is unstable, the first thing is required stabilizing the spine. If the neural structures are compressed and is the source of pain, that should be decompressed with the surgery. Once that part is done, then the next part starts a further treatment, which will be radio and chemotherapy. And the radiotherapy and chemotherapy, once they kill the cancer cells, they make the pain better. And at the same time, simultaneously, we have a pain team in our multidisciplinary team. They involved as well for acute pain management and then subsequently carrying on in a long term. Once the patient's pain come under control, their neurology gets stabilized, obviously we encourage them to engage with the physiotherapist to build their muscle and improve their neurology and carry on like that. Yes, definitely vertebroplasty is an important part of pain management. When the cancers damage the vertebral bodies, they become weak. And because of the cancerous cell, they are very much source of a pain. And if they are not coming under control with a normal pain management, we usually offer them a vertebroplasty or kyphoplasty, where we inject a specific cement into those vertebral bodies to make them stronger to stabilize them, and that helps in the pain control.